Hey everyone, my name is Erin Molan from Channel 9 and Today FM, and a really proud ambassador of Tresillian. I'm joined by the wonderful nurse Judy Tripodi. Great to see you, Judy.
Thank you, Erin. Happy to be here.
Isn't it wonderful? This is a great free event put on by Curash, who do the most incredible baby products, and I promise you we have used them at home since Eliza was born 3 years ago. They do great soap-free bath gels, the whole shebang. The baby wipes are amazing. They leave nothing there, which we know is a wonderful thing. Now, today we're talking about sleep like a baby. I've never actually really understood that saying, but after today's hour, you might, because Nurse Judy is going to tell us so many wonderful things, lots of tips and tricks that will really help you at home with your newborns. And I don't think there's any parent, particularly new parent, mum or dad or carer, that hasn't struggled with sleep. And it's not just about getting your bubba to sleep, it's about yourself as well. And so many of the inquiries aren't just, I can't get my baby to sleep, it's I'm exhausted and I'm struggling with my own mental health. And I think the fact that we can, in this day and age, there's no stigma, you can ask for help, you can acknowledge if you are struggling. There's nothing harder. You get home from the hospital and all of a sudden you've got this little thing that, yes, you've created, but you've got no idea what to do with it. So that's why we're here now to help. Tresillian's been here for 100 years. They are amazing. They're your one-stop shop for everything you need. A lot of people don't have support networks around them, Judy. They don't have parents or friends that they can turn to. You look at the moment at COVID, a lot of people can't go to their mothers' groups. They can't see people in person and get that support. So organisations like Tresillian are phenomenal. They've got an app, they've got a helpline that's sponsored by Curash, and they've also got centres that you can go to in person, take your bubba, and get some really genuine, wonderful help. They help 80,000 families per year, which is amazing. The number of searches online when it comes to your baby sleeping have just skyrocketed over the past year or so. 68,000 every single month. And I always find it really comforting, regardless of what I'm going through. If I'm going through a tough time, knowing that other people are going through something similar really helps me. You don't feel as solo in whatever it is you're going through. So know that you are not alone if you are struggling. Now let's get stuck into this. We've got an hour. You can send through your questions. A lot of you already have. So thank you so much for getting involved, because this is for you guys at home. This isn't for us. Mind you, I do have a 3-year-old who still sleeps in my bed, but that doesn't matter, because you might be able to help me by the end of this, get her into her own bed. But then I don't want her not to need me anymore. I'm complex. I probably need an hour by myself with you. First question. What is the best advice you can give to parents? There might be people listening now who are expecting a child, maybe in the next few weeks, the next couple of months. The best advice when it comes to sleep for your baby, for those who haven't had their babies yet.
Oh, okay, Erin. And we were actually talking about this on your radio show this morning with Gerard. There was a gentleman, a new dad that had rung in. I think my best advice is it's a steep learning curve. Not to put too much pressure on yourselves, to support each other. And I specifically said this to Gerard, like the woman can be overwhelming, especially if they're feeding the baby, and the hormonal changes and all that other sort of stuff that happens. So just for each of them to support each other and work together with the baby, because it's normal that babies wake a lot, and the most common issue seems to be lack of sleep, and that associated exhaustion and feeling overwhelmed and not able to think as clearly with stuff with a brand new baby. So to support each other there, but some tips for the baby that might help is to try early on in the piece to have baby get used to a day and night rhythm. And what's really helpful with that is with the baby to go out for walks in a pram during the day to feel that environment. That in itself is stimulating for a baby as well. But it helps the baby's rhythm and body clock get synchronised a little bit, which will help them learn to sleep better.
Because when you're pregnant, isn't it true that because you're moving around a lot during the day, Bubba is almost lulled off to sleep, and then when you sleep at night, that's why Bubba's kicking and awake? Or is that just an urban myth?
I think that's an urban myth.
Okay, well, that was helpful, Ez. Thank you.
I think often what I will say what I do ask some girls is there a time that your baby's active when you're pregnant? And it doesn't have to be in the night, Erin, it could have been in the day. And when the baby's born, you might find that that's the longer period that they're wakeful for, where they may not sleep as well. So they're sort of a little bit like that, but it doesn't just have to necessarily be at night.
What about crying? And you hear the term controlled crying, and a lot of people are vehemently opposed to that. Other people swear by it. Should you let your baby cry when you are trying to instill in them habits for sleep?
Probably depends on the age a little bit. If it's a younger baby, we would say not. And really, Tresillian doesn't endorse controlled crying. I do agree with you. It's called crying it out. Now there's different terms for the same thing, which is a very old-fashioned technique. But nowadays, like especially at Tresillian, and we've done a lot of research on this, we use a method called responsive settling. So we listen to the baby, and depending whether the baby's just protesting, whinging, or a really distressed cry, then we'll intervene sooner. Because we know if babies cry too long, they get too stressed, and then it just takes longer for them to calm. So controlled crying years ago was letting them cry for like 5, 10, 15, 20 minutes before you'd intervene. And we know now that's not the right way to go, because it would be stressful for parents, and I hear so many mothers that can't handle it. And also too, it's stressful for the baby too. So we intervene a lot sooner.
I think one of the things that really clicked for me, and my daughter's 3 now, but when she was a little bub and trying to figure things out, in my mind, crying meant distress and fear and anxiety. And anytime my daughter cried, I just feel physically ill at the thought of her being unhappy or stressed. But crying is how babies communicate as well. There are different types of crying. Crying can just mean, I'm hungry, Mum, or I've done a poo, or, that's right, isn't it?
You should come work at Tresillian.
I was about to say I'm wasted in TV and radio, clearly.
Exactly. So crying's baby's way of communicating, I need you. And it's us distinguishing, okay, what are they crying for? Could it be, and especially in these early months, there are developmental phases where they could cry for a prolonged period. And so it would be, okay, am I hungry? Am I cold? Am I wet? Am I tired? Or is it just I'm going through this sort of normal crying leap? So that's definitely, crying can mean lots of things. It's a late sign often of baby needing you. So at Tresillian in particular, what we've learnt now are these things, and what we support parents to gain confidence is things called infant cues, their baby's way of communicating. So there's and that's facial expressions, body movements, which you can pick up on a lot sooner before they get to the point of crying, which once they cry, it'll just take you longer to calm them. So that could be, Erin, something like, just say if it's related to sleep, your baby could be happily playing on the floor or that, and then you notice they start getting whingy, might have a facial grimace if they're a younger baby, were really intent on playing, then they just stare into space. And then you could even look at the clock then and think, oh, okay, you've been up a certain period of time now, I'll put you to sleep, before they actually cried too much.
Got you. So you've got to look for those signs that show they're tired before they get to a stage where they're stressed.
Yes. So look at those other hidden cues and that, Erin, definitely comes the more you're with your baby and you get to know your baby.
There's no rules when it comes to this, is there? There's no one-size-fits-all approach when you've got a baby.
No, everyone's individual. I think we're all individual. And even when you have more children in your family, you notice the individual personalities of your own kids. So, there's no one-size-fits-all. Certainly there's guidelines that you could follow, and I want to really stress that point to everyone that's viewing the webinar. Don't get too stuck on things if your baby doesn't fit that mould. That have some flexibility with this sort of with these sort of things that you might read. In particular, sleep and how long my baby should sleep for in the day. So many mothers will talk to me, my baby's not getting enough sleep. But then I'll ask them, is their baby happy and their baby's content and growing and learning? And then, well, they must be doing okay. So they have to have so much sleep in a day or night isn't really a big deal if their baby is happy.
Should you use milk to settle your child or to get your child off to sleep, whether that be breastfeeding or by a bottle?
Well, a lot of people do in the early part, and that's quite normal, I'd say. So when you've got a younger baby, a lot of them feed to sleep, be it breast or bottle feeding, and I think that's quite appropriate when a baby is, say, maybe under 6, 7
there was a stage
months
there
or whatever
where
like that.
I didn't take her off my boob basically because it was the only time she was quiet.
Yeah, but I suppose it's only an issue if it becomes a problem with them going to sleep, or if suddenly they start waking and the only way they'll settle is by having milk. And it sort of tends to be more common, I think, for breastfeeding ladies to do that, because there's always that question of, has my baby had enough milk? Are they hungry? Where compared to the bottle, you can see if they're having formula, you can see how much they've had. So you sort of think, okay, well, you shouldn't be waking for hunger because you only had a feed an hour ago or 2 hours ago.
Gotcha.
Breastfeeding, it's more common.
One question we've got, how do I improve my sleep? I guess that's directly correlated to improving your baby's sleep, isn't it? So as in from a parent's perspective.
Yeah, and I think depending on the age of the baby here, so let's just say we're talking about a young baby that's under, say, four months or something like that, where they might have long periods of waking and could be awake a lot at night. I would definitely say, and I suggested this to that gentleman that rung up, you rest when your baby sleeps.
That used to frustrate me so much, but it's so true, isn't it? You've got to sleep when your baby sleeps.
And just say me, I can't sleep in the day. I remember in my early days of nursing when I had to work night shift, I virtually lived on limited sleep because I wasn't a day sleeper. But even if you rest is better than not sleeping at all. And if you rest and wind down, you're more likely then to go to sleep yourself. So I definitely would say that for parents. And I often hear too, a lot of parents will say to me with an older baby, they might have a good first part of the night's sleep and then they could be awake every hour after 1 in the morning or something like that. I'd say to those parents, you might need to go to bed early too, where they might want to spend time with their partner, but you're just going through a rough patch at the moment. And you'll manage the lack of sleep better if you've got a bit of sleep on board, and even trying to settle the baby too when they're wakeful. So I think, so that's one easy thing I think you can do. And then the other thing to improve your sleep, and this is where Tresillian can help in a sense, is why is your baby waking up? Are there things that you're doing which isn't really assisting the baby to learn how to self-settle? And that's where we can assist families to look at that individually for them, to work out, okay, perhaps these strategies might assist you to help your baby improve their sleep. And sometimes I work with parents, say, in the day with that, to empower them to feel confident with it, and then that can flow over to the night.
One of our viewers wants to know, should they persist with a dummy with their baby if their baby won't take a dummy? Now, I'm assuming the baby's obviously not settling without it, so what's your advice on that?
Yeah, so dummies are a godsend if your baby wants it. And it's hard if the baby doesn't want the dummy. So, and people try buy all sorts of dummies, every dummy on the market, to see if their baby takes it or not. I suppose the reason would be, okay, why are you wanting to use the dummy? Is it to extend this baby's sleeps? And that's where you can use other settling methods, like, for example, if it's a younger baby, you can we've got gentle body rocking like this here, padding. If they're in like some bassinets, you can sort of rock the bassinet as well. So there could be other strategies you could use rather than going for the dummy.
Right, so they're all okay. All those methods are okay when your bub's young to put them to sleep.
Certainly, and they're foundation methods, Erin, which extend pretty much through your child's life. So certainly the older your child gets, you wouldn't be sort of rocking or patting them in bed. But other methods, say for example, we have, say for young, this is sort of like we've
have
got
to
a little
name it.
baby.
So this is Bob. We've named this, and Bob's 25 years old. You've had Bob for 25 years, so Bob has some bigger issues probably than going to sleep. But what kind of methods would you use with Bob?
Yeah. So with Bob, when Bob's a little bubba, then we'd use what I was saying before, like the padding, gentle body rocking, shushing, and that's in the bassinet here. And what I've done too, I've actually, and it's sort of hard to see, but it's actually across Bob's chest. So Bob's
wrapped Bob.
Bob's wrapped there. And then we have a firm top sheet or a lightweight blanket that's tucked in nice underneath the bassinet. So, because I'm mindful of Sit Safe Sleep guidelines.
Yes.
And
maybe go through those with us if you can.
Yeah, I might touch on that briefly, because this is something which has changed a bit, say for the grandparents wouldn't have been used to, in that we place the baby on their backs to sleep. Also too, the baby shouldn't have their head or face covered, because that prevents overheating. We have it looks very Spartan. There was a gorgeous little rug here when I first arrived with a beautiful little animal on the top of it, but that's not safe, because that could go over the baby's face and that.
So no
and that
pillows,
sort of thing.
no soft
no
toys.
No pillows, no bumpers. You'll notice that now. Parents worry about that, especially when their baby's older. They're going to knock their head against the cot and that. But we all know that this is, we want the ventilation to go through. So they're main things. Smoking too, I know that can be tricky, and breastfeeding or other. But, there's lots of ladies who formula
feed.
When you
say breastfeeding, what does that mean?
Well, they say that breastfeeding can help reduce the incidence of sudden unexpected death in infancy, but you're not ever going to make that difficult on a lady who's chosen to formula feed.
Absolutely.
So you put
and a lot of women don't have a choice as well with that, do they?
Exactly. So you've got all these other things in place with the baby on their back, like good ventilation, their head uncovered, that sort of thing. And I know I've lost track where we were going with that.
That's perfect. I think I've got another question here from Shauna. She has an 8-month-old standing in the cot. She's getting frustrated. I'm worried she'll get hurt. Should I lay her down? She tried. I remember going through this exact thing, Shauna, I feel you. And the baby just gets back up. Yeah,
well, that's actually interesting with Shauna's one, because that comes into the thing, will she get hurt? Because Shauna probably more than likely doesn't have bumpers or anything like that in the cot. I was only working the other day, Erin, with a mum, and she was worried about that when I was helping her. Her baby was 8 months as well.
And this is what you do at Tresillian. People can come in. You don't have to just do this. You can go in person and get your own individual advice, which is amazing.
Yes, and all free.
Yes, free. That is a great
free
point.
As well, accessible. Yeah. And what I said to her was, babies' heads are tough. So if the baby were to bump their head against the cot, like, odds on, really, they're not going to really hurt themselves. Her baby actually did have a bruise, but that was more from when we were just sitting talking. The baby slipped and fell against like one of the toys on the floor before. We had like a little big red mark on the head, and we figured that out wasn't from the cot. Right. But in answer to Shauna's question is she can lay the baby back down and sort of encourage and sort of say, come on, lie down, and pat the mattress, put her in that position, and maybe gently hold her there, but not force her to stay there. Right. Because it's normal at that age, at 8 months, and she's actually quite advanced, that if that baby's already standing at 8 months. So Shauna's baby, Shauna, your baby's very advanced. I'll probably be an early walker. But that's where you, so you wouldn't force her to do that. And sometimes
just gentle pressure.
Gentle pressure, but then Shauna could just sit like I am at the cot if the baby is standing or sitting, just so that she knows she's there to reassure her, and then saying, come on, lie down, and then keep practicing. An interesting thing at this age too, Erin, is that babies can get a bit clingy as well. Yes. And I have many parents say to me that sometimes their babies settle better if they leave the room.
Really?
Yes, at this age, because at this age it's a normal developmental phase, and they call it separation anxiety, but that can last for ages. Yeah,
I reckon I still might have a degree of it sometimes,
Yeah, and it depends on the temperament. I think this is where personality comes into it as well, where the temperament of your child is. Some are just more sensitive souls, where others are independent and, bye mum, and that, like when you drop them off at childcare and that. Yeah. So that's where sometimes for some babies who may be a little bit more sensitive, another option too is sometimes you can leave the room initially, give them a little bit of space to self-settle on their own, listening all the time, and if they get more distressed, then go in.
You were mentioning about how strong babies' heads are. I was walking past a wall and kind of knocked it when I was pregnant, and I was terrified that I might have hurt Bubba. Then you go to the obstetrician and they literally rearrange your entire contents of your stomach, like grabbing heads and moving around. You go, okay, these are very resilient little beings, aren't they, Bubbas?
Yeah,
They're incredible.
And your skull's there to protect the brain and all of that sort of stuff. And they might get, like a little egg on the head or something like that. But with a child falling or knocking their head is nothing compared to, like, just say if they they fell from a height. That's a whole different kettle of fish.
Absolutely.
But they're designed to explore their world and that, especially when they're getting crawling and all of that. So knocks and bumps go part of the course.
Okay, now Renee, my baby wakes a lot, only at night, escalating quickly, doesn't want food or a nappy change. How do I stop this or reduce it of an evening?
Alrighty, so what I probably have to say to Renee would be, how first does she put her baby to sleep? And that'd be interesting to know. And let's just assume she might rock, and we don't know how old this baby is, but just let's assume she's giving the baby a lot of support and may put the baby down asleep and then leave or whatever like that, then that in itself may trigger the baby to wake because they've been used to having a lot of support to soothe. So that's where, and just say if Renee wasn't doing that, but I probably would still say the same thing, the main aim is to try to pop your baby down initially awake,
yes,
or drowsy or calm, and give them the opportunity to settle on their own before you intervene, offering more support. Try keep them in the cot or bassinet first, and you can age appropriate, whether you need to pat, shush for a younger baby or just sit next to them for, say, a baby that could be 7, 8 months older. We try to pull back on a lot of the physical contact at that.
So that's the age, is it, when you start to pull back a bit on the touching, is 6, 7 months? Or
yeah, or maybe 7, 8, 9 months.
Yeah, sure.
Yeah, and I think that's individually where you feel that's right for you. So these are only just my guidelines, but everyone's individual. There's some parents who still need to have that close contact. So it's you gradually pulling back, but the main thing would be try to put them in their bed first rather than holding them and popping them down.
Right.
So if that lady's baby's waking up a lot, then she could sort of try that initially to have the baby more in the cot.
Now we have Ella, now 3-month-old, serial catnapper. She says she tries to settle, but she gets upset. How does she resettle?
Okay, resettling is always harder than putting them. And 3 months is tricky too because they're still little then. And I'd say with Ella, can she manage the baby when the baby gets so distressed and that sort of stuff? Because it's really hard. But I go back, Erin, you'll probably find I'll always go back to the same thing, trying to establish initially a pre-sleep, we call it a bedtime routine, but it's not limited just to bedtime at night. It's like before you put the baby to sleep.
Every time?
Yeah,
okay.
Having a bit of a ritual, a set of behaviours where, say in Ella's case, I'd be looking at trying to put the baby down asleep in the cot on their own. And she might even be doing that, but perhaps she may not be. And so the pre-sleep or bedtime routine would be, say, the baby wrapped. 3 months the baby could still be wrapped, or a sleeveless sleeping bag or a sleep suit or whatever like that. Give the baby a little comfort in arms, a song, a cuddle, a kiss, and then pop the baby in quiet, awake, slightly drowsy, and then tuck a firm top sheet over, feet at the end of the cot. That's another SID safe sleep thing I forgot to say.
Oh, feet, right.
Yeah, sorry, feet. Yeah, because I'm suggesting to tuck a firm sheet over the baby.
Yeah, the baby's
If the baby's up too high, the baby then could shimmy under.
Yes,
So you make sure that their feet are at the base of the cot.
Yeah.
And then general patting, shushing, leave. Now, when and a catnapper, I should define that. A catnapper is a baby just sleeping one sleep cycle.
Right, and how long's a sleep cycle?
About 30 to 50 minutes.
Okay, yeah.
And ideally, a good nap is 2 sleep cycles. So that could be an hour to an hour and a half. Some children have another sleep cycle, so you might hear these wonderful day nappers that sleep like 2 hours, very envious of them. But there's a lot of cat nappers out there.
Yeah.
And so at Tresillian, what we would suggest is, okay, to practice resettling the baby to help them link their sleep cycles, but often the resettling is harder. And that's where you may need to be more hands-on. So for 3 months, we'd definitely be having the baby in here, doing the padding, shushing, gentle body rocking. But then if the baby's distressed, pick the baby up, comfort in arms, soothe the baby down.
So you can pick the bubba back up comfort, then place Bubba back down. Okay.
Yeah, exactly. And you go back and forth doing that. Now, in the day, Erin, and this is just me, this is just my personal thing, but a lot of the Tresillian girls do the same thing. We might only persist with this for maybe up to 30 minutes max, and we're always being guided by the baby. So draw the line at that stage. Now, if you do feel, okay, my baby's really overtired, and just say they're used to being held to sleep or they're in the pram or that sort of stuff, then you can move them into that to help them go into that next sleep cycle, because it's important for them to get some sleep so they don't get overtired, and it's more consistent steps practicing this.
I learnt the hard way about putting Bubba down with their feet at the end, but this was a pram. The first time Sean and I ever took Eliza to the shops, it was like to the factory markets or something. She was, I think, 5 or 6 days old. And we put her kind of at the top of the pram, and then we went up an escalator like a ramp. When we got to the top, we looked in, she was gone. She'd slid all the way down. So it's good advice. It was quite terrifying as new parents, to be honest. Yeah. Okay, now Emma wants to ask, how do I teach my son to self-settle? So he's 4.5 months old, sleeps for a maximum of 45 minutes. He sleeps with her, but she says it's not ideal. Yeah,
so he's sort of similar to Ella's baby in a little sense too. So my advice would be exactly the same. And so it would be for her, because if Emma's having him sleep with her, which a lot of parents do, it would be her getting the confidence to, think, okay, I've got to get him in. And at 4.5 months, he probably more than likely would be in a cot. Because the bassinet, they can outgrow the bassinet. This is actually quite a big one. And I think this one's 100 years old. It's really old.
This is one that's at one of the Tresillians. I think I saw it when I went and had a look at Wollstonecraft,
the wicker one that we used all those years ago.
Yeah.
So this is actually quite a large one, but I have noticed now the ones used nowadays are a lot larger than what they used to be. But 4 months usually in a cot, and I think be interesting to see if she co-sleeps with him in the day. But she could practice popping him in the cot in the day, and then definitely at bedtime. It's her just taking that plunge to practice, but it's consistent practice. And we've got really good tip sheets on our Tresillian website with all of this that I'm going through too.
Great.
And I think in the case too of Emma, she might be a good one too to ring in for the parent helpline. Because we tailor something individual for her and try and find out what's holding her back that she can't do this, where it's easy for her to have him in with her.
Because often it's just, you know what to do, but it's someone giving you the confidence to do it yourself, to know that you're not doing damage or you're not doing the wrong thing. It's just empowering people.
Yeah, and Erin, I saw a lady only the other day that came for support. She was doing everything perfect. I couldn't tell her anything really different. All I could say to her was that you're doing everything correctly. And I think you just need that sort of validation by a health professional that makes you feel okay about that. But it's consistent practice and giving yourself a time frame, because I feel that we're all used to, and I'm no different, okay, I've got this problem, tell me the solution, it should be fixed in a day or two.
Yeah.
With supporting babies to sleep, because you're trying to change their behaviour, your goal might be a lot longer. And I usually say to parents, allow about 4 to 8 weeks.
Then it feels like the second you figure it out, they go into a different cycle and they change their behaviour, and it's always changing, isn't it?
It is, and that's the I think breathe a sigh of relief. Now, how old did you say Eliza was?
3.
I usually sort of say, if you give a sigh of relief about 3, if they're sleeping all good, because then developmental changes shouldn't impact anymore.
Sure.
But there's a lot of brain development that occurs in the first 2 years of life, and sleep is very sensitive to that. So you'll find you'll have a bumpy, you might go through a good patch and then things go off the rail again, where suddenly, oh no, I've got to start supporting my baby more to sleep and that sort of stuff. But that all comes part and parcel with it.
It's all normal.
Yeah.
Nicola, my husband is anti-dummy, but I'd like to try it for settling. Is there any basis for the stigma relating to dummies? I think some people worry about buck teeth or that kind of issue, or a reliance. What's the stigma surrounding dummies, and are they okay?
Yeah, I think what you were saying, there's that stigma. And also, I don't know, when you sometimes see the older child walking around with a dummy in their mouth.
Like
and
if they're 12.
Yeah.
Slightly, concerning.
And there's that oral hygiene aspect too, like when they've got a lot of teeth and like the dummies can be dirty and that sort of stuff. I sort of think the dummies are okay when they're needed. We definitely use them at Tresillian, and they're a godsend for babies who have reflux.
Yes.
Because the sucking on the dummy is self-soothing, and that can help reduce pain and that sort of thing as well. So I suppose the main thing is just thinking when you use the dummy. They can definitely become an unhelpful sleep association as the baby gets older. But I feel you've got to fight your battles a lot of time.
Absolutely. One of the things is if they can't put it back in themselves, isn't it? Because it's all good and well having the dummy, but if they lose it every 5 seconds, I keep thinking like Maggie from The Simpsons. Yeah. She lost hers constantly. And if you've got to put it back in, well, that doesn't help, does it?
Yeah, and I think, and I can think of somebody only the other day that asked me this question too. Their baby, they had to replace the dummy about every hour. And that's where I sort of said to them, okay, I think it's time to get rid of the dummy. Yeah. If you're only getting up once or twice at night, I think you can manage that. And this lady's baby was about 4 months. So that lady's baby was younger, where sometimes this is more the second 6 months of life where it might become more problematic. But yeah, I sort of think, everyone's individual. And if the dummy works and you've got sleepless, you've got a very unsettled baby and the baby settles on the dummy, then certainly go for it. But maybe try other things. People get automatically used to, just popping the dummy in. Try those other settling methods first.
You mentioned reflux quickly. We were very lucky, Eliza never had any reflux, but so many of my girlfriends just had the most horrific experiences with reflux. Some tips for mums and dads listening now that might have babies with reflux would be great when it comes to sleeping.
Okay, get help.
Yeah, absolutely.
I'd say that, I don't know if they're listening, I've got a nephew and his wife who have just gone through all of this. Yeah. Get help. And it was even tricky for me because I was with them, I was sort of...
Just explain what reflux is quickly, actually, just in case anyone listening doesn't understand.
Okay, so there's a normal reflux and the pathological reflux. So the normal reflux is babies' tummies, they've got their stomach and there's a muscle that helps stop us regurgitating our food. In a young baby, all their muscles are weak, so that muscle around the tummy is weak too. So it's normal, and a lot of everyone that's listening would have probably experienced this. When you feed your baby and you burp them, they might spill a little bit of milk. Which we call a posset for some reason. Don't ask me where that word came from. Posset. Okay. Don't ask me where that word came from. That's an old-fashioned word to describe that. With the pathological or the bad reflux, the acid, stomach acid comes up with that. And it's sort of a slow onset with that. It's coming up and down their esophagus. And I liken it to like you grazing and reopening a wound and that sort of stuff. It doesn't have time to heal. So as the weeks pass with your baby, they get more and more distressed. And these babies, Erin, cry a lot. And they might cry during a feed, cry after a feed, because you think most times a baby after they've had a feed, they're usually content. But these babies are unhappy because their tummy distends and that acid's going up
and down. It's like indigestion, because I know when I was pregnant, a lot of pregnant women struggle with indigestion. There's nothing worse. It just feels awful. Is it similar to that?
Yeah, it's similar to that. And some of the medication is similar, but it's appropriate for babies. So in the case of reflux, you do really need to see like your GP or paediatrician, because it's a medical condition where, from my experience, most babies improve once they're on medication. The medications are very safe. They've been around for a long time. And then on top of that, then Tresillian can help because a lot of times with these babies, they have poor sleep because they're always in pain. So you have to get the medical condition treated first, and then Tresillian can come in there to just help with the settling and that sort of stuff.
Now, I know we've covered this to a degree, but Lillian, there might be another thing that you can add. She says her baby loses a dummy during the night. She's now 1 year old and still can't replace the dummy herself. So we just touched on this. She's exhausted, Lillian, we can understand that. And she's worried about removing the thing that helped her initially. I guess it's just that trying other methods that you were mentioning.
Yes, exactly. Now, her baby's 1 year old. Yes. So her baby's a lot older. And so Lillian's baby would probably protest quite a lot, not having the dummy. So the older that they get, and they get very loud, and
the harder it is, isn't it, to take it away? It's harder.
And, you know, when they're really crying and distressed in that, it's the middle of the night, and, you know, all I got to do is just give the dummy and we can all sleep.
We're all guilty of doing whatever we can to just survive and get through, but long-term might not be the best solution.
So probably what I'd say to Lillian is that I would try in the day first.
Good advice,
Putting the baby down without the dummy. And Lillian with a baby at 12 months of age would be sitting next to the cot and having that reassurance walking out of the room. If the baby's really distressed, and that's where I mentioned early on, Erin, all these methods, like even holding your child, you can always hold your 1-year-old too. Of course, some will cough, gag, hold their breath and all the rest of it. And that's where you know they're getting too distressed with what you're doing. So you want to bring that.
Sorry, is that a part of
where
the crying?
They cough and then they might go, like that sort of stuff. Some even vomit, like some children vomit when they're really distressed. So, and that just makes you think, oh, I'm going to stop completely what I'm doing. But you probably let them go too far before you intervened. So that's where it's you, for Lillian's case, just practicing those techniques to help her little one settle on their own, and then give the dummy, because it's important for them to get some sleep. I think that's a gentle approach. Some people go cold turkey. And you have to be in that frame of mind to manage their distress. And there's many parents I know that have done that, but you might be in for a week of hell to get to the other side. I think more realistically, a lot of parents give in before that. So I usually would suggest start in the day, move to bedtime, and then that can have a flow-on effect at night. But as you gain more confidence with the settling skills, you'd probably then would feel more confident at night to practice it. And those tip sheets, we've got a good one for the older baby on our website.
Oh, great. Okay. Now, Danielle, my 7-month-old still has 3 bottles nightly and tough getting them into her routine during the day, and then they're up all night. How can I get them to sleep longer?
3 bottles nightly and then up all night. Okay. So that would be go back to the settling, the settling too. I mean, at 7 months old too, you're starting to offer food.
Yes, that's right.
Yeah.
And so that's from around 6 months, is it, that you start
to... Yes, from 6 months onwards. Yeah, so close to 6 months. So it would be interesting to see too if the baby's having 3 feeds overnight, because at 7 months, usually the baby might have 5 feeds in 24 hours.
Right.
So I'd be interested to know with Danielle, is her baby's solid intake enough? Because the baby's probably filling up on too much milk and not eating as much food in the day.
Yes.
And they're needing that variety of the different nutrients after 6 months of age rather than milk alone. So it would be spacing the bottles to see when are those, how far apart are the bottles. But, you know, at 7 months I might say, okay, you could have a bottle before midnight, but then resettle your baby like it has 4 hours. That's reasonable at 7 months. So if the baby was to wake, say, at the 2 or 3 hour mark, resettle then. And that's using all of those settling methods that we've already said. There's only so many tools in the basket, per se. And they're tried and true. They work. I can assure everybody with persistence and patience, all of these methods work. It's you just getting the right headspace to get there, which is often the hard thing to do. And that's probably what I would say to her. Danielle's probably another person who might benefit from Tresillian, I'd say as well. Yeah, because we can look at their routine in the day too, to sort of see how that can complement the night.
It's incredible how much that occurs during the day impacts how they sleep at night. It's almost the most important part.
Yes, yeah, exactly. Like, you know, when do you feed them? How do you put them to sleep? Small babies thrive on routine and that. I think it's always very evident when they get more at school or preschool and that, just how kids just feel so safe when there's structure happening and they know that this happens this time and that happens at that time. And it's true for a younger baby who may not be able to verbalise that as much to you.
Okay, well, Carly, my nearly 3-month-old has never had a good night's sleep in his bassinet for naps during the day. So they're demand feeding to help with his weight gain. So he's obviously a little bit underweight. So I never know how full they are for a nap and also for the nighttime sleep. That's tough. Do you have any advice?
I'm just going to read that one again because Carly's written quite a lot there. So her 3-month-old's never had a good night's sleep in his bassinet for naps in the day, demand feeding and also for nighttime sleep. Yeah, and it's tricky if they're worried about the baby's weight.
Yes.
But I think demand feeding may not be the way to go. Because if she's
demand feeding is just when your bubba cries, you give them food, essentially.
Yeah. So she could, and let's just assume I'd assume that she'd be breastfeeding, in a sense, if they say demand feeding.
And she also doesn't know how full she is as well, which also makes it harder for breastfeeding.
So I'd assume that she's breastfeeding now. So that's where having, interesting with breastfeeding, sometimes if babies snack on the breast, they get more of that watery part of the milk, Erin, that can cause more tummy.
The colostrum, is it? Or no? That's what comes through earlier.
Colostrum's, when you first start, and then it goes to like mature milk when your milk comes in. But that first part of the milk, breast milk contains a lot of water, sort of. And I'm a lactation consultant too, and I've already forgotten how much. But it could be, let's say it's a huge amount of water, and then it's got other components in it as well. But the first part of the milk is always more watery. There's a higher water content, and the further you progress in a feed when you breastfeed, say you're feeding from one breast, the baby gets more fat in the milk. So if you were to take samples of your breast milk at certain times, you'll see it's like really milky to start with, like a bluey tinge, and then it'll get yellow and more creamy.
Oh, wow.
Yeah, and that actually would help with Carly too, because if the baby gets more of the hind milk, we call that, that's higher fat, that's more calories, that will help the baby's weight too. But when you demand feed, just say you're feeding every hour or two, the baby can get more of that watery stuff, which doesn't have as much calories per se to put the weight on.
So they're just having lots of quick feeds
rather
than
feeds.
A big
their tummy's
chunk.
never that full. Yeah. And then they can get a bit of wind pain with that too, and that would make them wake and all the rest of it. So at Tresillian, what we would say the first thing is we talk about a feed, play, then sleep pattern of care to provide a routine to help support better feeding and sleep. And age appropriate it is too, and we haven't really touched on that, but just say for 3 months of age, I think at 3 months it's reasonable, even breastfeeding, to breastfeed at 3 hours at the earliest, a 3 to 4 hour flexibility. You don't have to be strict with time. Some people are, which I notice a lot of girls must read blogs or books or things like that, and are strict, like I feed my baby at this time, where you can have a bit of flexibility with that. But in that lady's case, yes, I'd say try to space the feeds to 3 hours, feed the baby when the baby wakes, then at that time floor play, tummy time after that, and then prepare the baby for sleep. And we talk about an uptime or a wake window. I hear a lot of girls calling it that now. I quite like it actually. Yeah. And for 3 months, probably about an hour and a half, possibly 2 hours before the baby's getting tired, and prepare the baby for sleep. And that's where she might be misreading cues with that.
Right. I remember when I was breastfeeding Eliza, and it'd be like 11 o'clock at night or whenever it was, and I would feed her, and every time I'd feed her, she would wee on me. And I'd be like, I don't understand. She's got a nappy on. Is it leaking? It would happen, I think, for about 2 months it happened, and then I realised it was my other breast leaking.
Oh, okay.
So yeah, that's another handy hint. I'm probably the only person in the world that's ever happened to, because other people would get that. But that's so bizarre how that happens. Yeah. How do you stop that?
Well, you can't really. You know what? There's lots of products now to collect that milk.
So you don't waste it.
Yes, and I think that's a really good idea.
It is,
so
absolutely.
Then you can keep that where you've got your little milk bank there. If ever you're out in that, and your partner or whoever's looking after your baby needs to sort of give the breast milk. Yeah, that's just in the early days when you breastfeed, Erin, you tend to have always more milk than less. Some women are like, I actually spoke to another lady just recently this week who could have probably fed the community. She had so much milk. And, and so it's, now I've forgotten where we were going with that, but it's, I've lost my feet.
Well, I'll another one. I was my first day back on Channel 9, and I had they put up a photo of Eliza. I think she was 5 or 6 weeks old, and just full leakage. And I work with footballers, so it was not pleasant. Oh my dear! But hey, it's life, right? That's part and parcel.
No, exactly.
Okay, should your baby have a set bedtime?
That's a good question. I probably would say a bit of flexibility there, but I must admit I do say like we have about a 6:30 to 7:30, perhaps 8 p.m. window where that could be time to prepare the baby for the night.
Sure.
When they're a young baby, of course I'll have ladies with babies 5, 6, 7 weeks of age looking at that. It might be a little bit unachievable because the baby's internal body clock hasn't kicked in at that time. But definitely say from about three months on, I think that's okay to have that period to think, okay, now this is the wind down time of the day for you now. So that could be like a bath, soothing massage, a feed, a cuddle, and that,
God,
and then
they
popping
have
the
the
baby.
life, don't they?
Yeah.
That sounds absolutely. I mean, obviously, a wine for us adults, but that sounds perfect, doesn't it?
Yeah, and I mean, it may take you time to get there doing that, but I sometimes think of 12 hours like you got your day and your night. So just say day is say from 6 in the morning to like 7. If that's a little bit more, that's 13 hours. But that's the day, and the night could be from 7 to like 6 in the morning, and think of it that way. So you're not wanting to party with your baby at that time of night, which often people do because the partner's coming home from work.
Yes.
They've missed out on seeing them. They're partying and babies are going to bed like at about 10, 11 o'clock at night.
That's a great point.
Yeah.
And because you can understand why parents, if they've had to be at work for, 12 hours of the day, they want to come home and bond, particularly dads, who sometimes dads do. We might talk about dads really quickly. A lot of times dads will struggle to have that bond with the baby. The baby's obviously being carried by the mother in most cases, and when you're breastfeeding and there's that natural affinity, but how can dads create a lovely bond with Bubba?
Yeah. Well, I think depending if they're able to feed the baby or not, so if the baby's on the bottle, they can always do with that. Getting involved in all other aspects of care. So if the mother was breastfeeding, but they're there to change nappies, and they can certainly be there to help with the sleep and settling. And also on days off, walking. I love seeing that when I live in a lovely area where we've got a beautiful walkway, and I love seeing the dads with their babies, just them on their own walking along. So all of that aspects that the dads can do, and to give mum a break as well, because that's a good opportunity for her to have some me time.
Absolutely, it's so important, isn't it? Now, Jessica wants to know, my baby is 7 weeks old and bottle fed. Would introducing a dream feed help him stay asleep for a longer stretch of time?
That's actually a really good question. Well, she could certainly try it, but it may or may not work.
What is the dream feed again? It's that like 11 or 10 o'clock?
It's that late night feed.
Just explain that to us,
Yeah, so it's the last feed before midnight, say.
Right.
So the dream feed is traditionally between, say, 10 and 12 p.m. And when the dream feeds are a spin-off back in olden days, in a sense, when we scheduled the bottles of milk. And so that may not work as well if the baby's breastfed, but some girls who are breastfeeding sort of try to do the dream feed. I wondered, oh, hang on, she's bottle fed, Jessica's baby.
Yes.
So that's where she's singing. You could really only do a dream feed a little bit more with a bottle. So Jessica's probably thinking, oh, maybe if I pop the bottle, maybe her baby sleeps more at that time, and and maybe more wakeful after that. I mean, she could certainly try, and if it works, good on her. But
then you hope you get a longer stint to have a sleep yourself potentially after.
Yeah, but if the baby was to wake like 2 hours after having had that last feed, then the baby's going on their own body clock and what they're wanting to do. And at 7 weeks, it may or may not work.
This is a great question. Do you recommend waking, this is from Kate, a newborn to feed every 2 to 3 hours, or do you let them wake on their own? Because we have this exact issue sometimes, I mean very rarely, but if Eliza would just stay asleep and you think, oh gosh, do I need to wake Bubba? Or if your baby's going to sleep, can you just let them sleep even if they're little? Yeah,
I think it depends on how much milk Kate has.
Yes.
Certainly if her supply is low and her baby is young, we would be saying, and I say the same as a lactation nurse, to not let the baby maybe go more than 4 hours overnight.
Right.
Yeah, where in the day we might say 2 to 4 hours, and then I'll say up to 5 hours at night. But the other thing with a very small baby when you're breastfeeding, Erin, is that you make a lot of milk overnight. There's a hormone that helps you produce milk. So her breast will probably leak, or they'll wake herself up because they'll be like really sore. Yeah. And we need them emptying to facilitate really good milk production from her. So in those...
So almost more for the mother than for bub sometimes to have those regular feeding.
Yeah, yeah. But I certainly think if her baby is thriving and there's no issues with the baby's growth, good lot of wet nappies, pooping okay, let the baby go as long as the baby wants. And so that could even be, I think rarely the baby might go more than 6 hours, and she'll probably wake up with discomfort. That's the only other thing. If she was to wake a little bit, we don't want her to get mastitis or anything from the milk staying in her breast for too long. But in answer to that, she doesn't really necessarily need to wake the baby at 2-3 hours. That's quite early.
Okay. Rashma, my 4-month-old doesn't take the dummy or bottle, but he always puts his finger or his hand in his mouth. What would be the reason for that? And she is asking, how can I stop him? Does she need to stop him?
No, that's actually a good question, because we're talking about development here now, which we haven't touched on.
Yeah.
Rashma, that's all normal, and your baby's actually developing really well because they're exploring their world. Yes, they're exploring their world. So babies explore through orally, and that's where you've got to be careful then, because you've got to think of safety. Are they going to pick up something small off the floor and choke on it or something like that? So suddenly you're at ground level where the babies are looking to see what could be dangerous there. No, you definitely just let them do it. It's not going to hurt. And people worried like, oh, are their hands clean? Are they going to get... I think you let go of that, Erin, don't you? Because once you see them putting anything in their mouth, you tend to let go. And the mouth is all full of sort of bacteria anyway.
It's character building, right?
Yeah, well, the gut's there. We talk all about the microbiome now, the gut, and how the gut's so important as a barrier against infection. So it's all being primed at this young age too. So, I think if the baby wants to put their hand or fingers in their mouth, perhaps she needs to put a toy in it or something like that to get them, because they're wanting to play. So she might need to do that. But if the baby's doing it for sleep, for example, thumb suckers, we didn't touch on them. We talked about the dummies, but not the ones that suck their thumb. A lot of children too might suck on their fists, and that is a way to soothe. So they may not want the dummy, but as soon as you take the dummy away, that might go in. They'll replace it with the thumb. Yeah.
What about co-sleeping and sleeping individually? So we did all the right things with our daughter. She was in a cot for about 6 months. We went on a holiday, I think, probably a year and a half ago now, where she slept in a bed with us in a hotel. Hasn't left ever since. She's now 3. I know, Sean, I'm getting onto it. I promise this is what we fight about. But is co-sleeping okay, and up to what age, and what do parents need to do to make sure it's safe?
Okay, if I have to draw the line, and I do have to say this, Erin, because I'm representing Tresillian and the Safe Sleep Guidelines, they don't recommend co-sleeping.
Right, okay.
Just because there's that increased risk of maybe the parent rolling on their child.
Is this just when they're very young, when they're newborns, or just generally?
Well, probably the incidence of, and they call it sudden unexpected death in infancy, where sudden infant death syndrome is a component of that. Right. That's most prevalent in the first 6 to 12 months of life. So I suppose if you've got an older child, in a sense, like we've got Richard here over there who's talking to me about his 2-year-old before.
Well, that's the thing. For the first 18 months, we didn't at all. And I would be, to be honest, too paranoid. I would be too nervous at that age. But she's obviously a little human being now.
So when they're older, there's that risk isn't as much there. So, but culturally, a lot of cultures do. But I do have to say, like, I know, we do have to be open about things, but if parents might be intoxicated on alcohol or drugs or that, we wouldn't be saying, have your baby in bed with you then. No, so there's all those safety aspects as well. But now, what were you asking me with them?
The best option is to have Bubba in their own space, especially when they're newborn and young.
Yeah.
And you can still have cuddles and stuff during the day, but for sleep at night, you recommend absolutely.
I would say that more than co-sleeping, because like as you've experienced now, children love to be with you.
Ah.
And the older that they get, it's harder to get them out.
Yeah, I know. Mind you, she is asking me now, but she did ask where her own bed was the other day. So someone at preschool's obviously gotten in her ear. And when we go to other people's houses, I can't let them show us kids' rooms because she'll be like, why don't I have one of them? Yeah. So the time is right, I know.
Well, it might be nice making a nice sort of bedroom for her with her own beautiful bed and nice sheets and things like that.
Exactly. Yeah. Now, we'll finish nappy rash. This is something we've struggled with. I know so many parents struggle with this a lot. Not directly sleep related, but what kind of things can you do to avoid nappy rash?
Yeah. I think, definitely, probably looking at the products that you use. So just say the nappy, for example, probably different varieties. Is there something on the nappy that could be making the baby's skin sensitive? Because there's lots of children I've noticed too with eczema or sensitive skin and that type of thing.
Enter Curash with their amazing products like soap-free bath and the great wipes. They're wonderful, specially formulated for sensitive skin. And I promise this is not planned. It was a legitimate question. But yeah, products are a big part of it.
Yes, definitely. And that's where sometimes you might even need to ease back on a lot of stuff, a lot of things too. But with, so I'd look at the products that you're using on the skin, looking at the nappies that are on the skin, but also how you're cleansing. I know that baby wipes and all that are like very popular now, but sometimes they can irritate the skin too. So even when you're at home, just using water to cleanse the skin, and definitely like if they're pooping and that sort of stuff, not leaving them in the nappies for as long. I usually, and this is a throwback from olden days, a good barrier cream. So a zinc-based barrier cream. That's a tried and true method, and there's lots of brands of them on the market that the parent can use as well.
Okay, any final words of advice for our incredible viewers right now when it comes to basically looking after themselves if they are? I know what it's like. We've all been there where you're just so exhausted. It's hard to see light at the end of the tunnel. It does get easier, doesn't it? It does.
It does, yeah. And you know, these times, even though they're challenging, when I look at it now, and I've got daughters who are young women, it's beautiful times that in the essence of it all is a quick part of your life as a mother and that sort of stuff. So I think try to enjoy it as much as you can. If you're going through a difficult time, and we definitely know that there's some women who get into a dark place with anxiety or depression and that sort of stuff, reach out for support. And like you were saying right at the very beginning, Erin, there's not a stigma to saying that. And I think the first person would be probably just sharing it with your partner, someone you trust, a family member, a close friend, because sometimes just that sharing is all you need to do. And I facilitated a mother's group yesterday of young mums where I was asking them all this question, like what advice would they give? And to a new person if they asked them, oh, you know, I'm having a baby. And one girl said a wonderful thing like, trust your mothering instincts.
Yeah, absolutely.
You have a lot of people commenting. You filter through.
Gosh,
and do
advice
what you
is
think, what you want to do.
Everywhere when you have a bubba, isn't it? People love to give advice, which is lovely, but not all of them are qualified.
No. And another lady who didn't have family here, it was her second child. She didn't accept any support with the first, but she said she just let anybody help her the next time.
Wow.
So if someone wants to volunteer to help make you a meal, do housekeeping, hold the baby for you. Anybody can do that, so you can have a break and take some me time too. And that's when you were talking before with the dads.
Yes.
If the dad can take the baby a little bit just for you, just to do something special for you. And I think, and I'm getting back to like when I was saying before about the baby going out in the day for a walk, you two do that together, because exercise out in the sunshine is just so good for our mental health.
Oh, it is, absolutely. And I think I look back now at the first few weeks and those first few months, and I miss those nights where it was just me and Eliza up at, 11, 1, 4 a.m, and they're the most special, incredible times of your life where you are just solely responsible for the life of this thing that you love so dearly. It's just incredible. Judy, Tripodi, you are phenomenal. Thank you so very much for your incredible advice. Thank you all so much for joining us here. It's been incredible. If you do need some extra support, you can call Tresillian on 1300 272 736. They've also got a great app. I actually met the other day the lady who had helped develop the app. It's a wonderful, wonderful resource. Of course, a big thank you to Curash who have sponsored this and also sponsored the helpline. These things cannot happen without the incredible support of wonderful companies who care deeply, and Curash do. Thank you so much for listening. All the stories I told were off the record, obviously. We really appreciate it. Thank you so much. And of course, just enjoy every second, and it's okay as well to struggle and to seek help. So take care, everyone. Thanks so much for your time.